let us start with the hardest question of the day.
All right.
Did I get your first and actually, if you just take it, the wire right there, you can just kind of push it along your back. There you go, perfect. Excellent job. All right, back to the hardest question. If I could get your first and last name, spell out for me and your title.
Joseph Forrester, Josephforester. I'm an allergist immunologist at Allergy Health.
Perfect. So, I guess let's start off. We have this kind of haze coming over the state at the moment. How has it impacted your patients so far?
Sure. Well, we are seeing an increase in lower respiratory symptoms, especially in people who have asthma or other underlying respiratory problems like COPD and such like that. But also, sinus symptoms, eye irritation, increased nasal drainage, everything you would see typically with allergy symptoms, we see with these, the dust and particulates that are currently in the air.
And now we talked about the dust. We also have some smoke coming in from wildfires also. I mean, how often during these events do you see an increase?
Well, you can count on the Saharan dust causing a problem around this time every year. The size of those particles, and if you were to do an air quality search today, you would see that's the predominant irritant in the air right now is the 2.5 to 10 micron dust particle or particle that's in the air right now.
Just making sure we're still good. All right, perfect.
Yeah.
So, let's talk about the air quality. It's been pretty poor over at least the past week. What do you recommend, for people who, or maybe even just for patients, you say, hey, look, I want to get out and about, but I'm having trouble breathing. I'm dealing with this haze. Kind of describe what kind of your at-home solutions are.
Sure. So there are some common sense things people can and should do if they have asthma or other respiratory problems. Number one, try to avoid exposing yourself to it. Unfortunately, if you go outside, you're going to be exposed to it. If you must be outside to do work or other things, you might have to wear a mask, like a dust filtering mask, not a medical mask. That can help. But remaining indoors, keeping your doors and windows closed, running your air conditioner, making sure your HVAC filter is clean, and replacing that as you should, those things will help decrease exposure. Also, if you have asthma and you're prescribed medication, make sure you're taking those medications as prescribed. This would not be a good time to try and wean yourself off of it unless you're told to do so by your physician. Having an indoor air filter sometimes can help as well, especially in your sleeping environment. In a closed environment, running a HEPA filter can help keep your air clean indoors until this passes and the air quality improves outside.
And then, you talk about how this passes. How long do you usually see these events, when they happen? How long can it affect people? Is it just, during the event, or do you sometimes see long-term effects?
Well, certainly during the event, that's when we're going to see the peak. But if it leads to like an asthma exacerbation or an asthma attack, those can take several days to weeks to recover from as that inflammation improves in the lungs. So even after the pollution clears, we may still have some lingering effects for a few weeks.
And then I guess for my final question, let's say someone is going through this, they've never had any issues before, but they've all of a sudden, they're starting to have, coughing, they're wheezing, they start having asthma-like symptoms. When do you recommend saying, okay, hey, here's the time to go to an emergency room?
Sure. If they have a treatment plan, let's say that known existing asthma, and they have a treatment plan, they should follow that. And usually that involves using their rescue inhaler more frequently. But for anyone, indications for going to an emergency room or an urgent care or calling up their doctor to see if they can get in would be if their symptoms are unresponsive to their treatment. So if they have, let's say, a rescue inhaler, whether it be albuterol or AirSupra, and they use it but their symptoms aren't getting any better, they should seek care for that. Or if their symptoms are so severe that they're having trouble carrying on conversations in full sentences, they're experiencing chest pain or any lightheadedness, anything like that, that's certainly an indication to get to an emergency room sooner rather than later.
All right. I don't have any more questions, but is there anything I might have missed or glossed over that you want to add on to?
I need to double check myself real quick because I said Ah,
Well, for
oh, it is micron. I think it's microns. Just don't quote me on the size of those,
oh yeah,
because I'm not 100% sure. You might want to take that quote out. I'm not sure. It's 2.5. It's actually called PM 2.5 and PM 10, so it's not 2.5 and 10 microns. So
okay.
I
All right,
think
I'll
we can
be
take
sure
that
not
out.
to use that then. All right.
Okay.
I don't have any more questions. Let me just go ahead and stop the recording.
Okay.